Ann Beater here, the medical director of Headstrong project. And here we are with Gerard Ilary and Dr. Carol Weiss. And we're delighted with introducing to you our new executive director. And I'm going to turn it over to Gerard.
Yeah, I just wanted to say that we are very excited to see and have Jim here. And one of the first things that Jim McDonough said to us when he met us was that when could he get in front of the clinicians, because he really wanted to meet them and be able to tell them why he has a passion for mental health and for Headstrong, and also how he plans to sort of expand our fundraising efforts, et cetera, so that we have more resources to treat more veterans. So without further ado, I want to pass this over to Jim and let him tell us a little bit about himself and those items.
Well, thank you, Gerard, and thank you, Dr. Beater and Dr. Weiss. It's an honor to have signed on to this wonderful organization. So listen, I'll tell you just a little bit about myself and why I came to these responsibilities. After serving almost 30 years in the active Army, my professional responsibilities have kind of airlifted me into the military-connected sector. The one responsibility that I never had, but always wanted, was to be associated with an evidence-based practice that was actually in the business of improving upon the mental health outcomes of our nation's veterans and their families. And there's no finer organization in this country than Headstrong. I've been associated with the brand since it was founded in 2012, and I've always been impressed by the impact, but most importantly, the clinical standing that I think Headstrong represents for our nation's veterans and their families. So for me, it was an opportunity to round out my professional responsibilities with something of a last stop, if you will, for the next 5+ whatever years it is, to kind of lend myself and my experience to really the one remaining chapter in my book is around treating the invisible wounds of these wars. And this for me is a true honor. So that's on a professional level. On a personal level, I come from a military family, and the newest second lieutenant in the Engineer Corps for the United States Army happens to be Second Lieutenant Nick McDonough, who just graduated from the University of Vermont. So for me, there's a personal responsibility here to ensure that as our nation continues to treat the wounds of whatever wars, that we do so based upon evidence and science and the ability to demonstrate impact in people's lives. And that is the Headstrong brand. It is renowned in this country for helping people like me, helping those around me deal with the wounds of war. And it's really both, Gerard, professional and personal. And I've said that repeatedly, but importantly, it's just my strong desire to continue serving.
That's great. And is there something else that you'd like the therapists or the clinicians to know in terms of what you think you will be bringing to them and bringing to the organization?
Yeah, I mean, that's why I asked for this. I wanted to get front and center with the clinicians who are Headstrong. I want to be very clear that Headstrong is a group practice, if you will, of the nation's best clinicians in the business. And so as they were rolling me out to key funders and key stakeholders, I turned to Gerard and others, and I said, well, look, I'd like to talk to the clinicians because that's what this organization is built around. And what I want all the clinicians to understand within this wonderful practice is that I'm here and I exist for you. My role is to see your role expand, in really simple terms, to be able to deliver the evidence-based treatment that you're so good at scale across the nation, and to really think of this, to reimagine it as a national practice of the nation's best providers in the business at treating the invisible wounds of war. I will do so in strong partnership with our federal government, our state governments, our municipal governments, really to fundamentally create long-standing sustainable threads of revenue mixed in with my responsibilities to raise revenue through the good old-fashioned way, grants, philanthropic partners. But for me, it's about presenting to our nation the ability to kind of get care in a community from the best in the business, which we are, or if you choose to get it through government, and all the federal streams that are there and the state streams, and you need help from the private sector to become the provider of choice for our nation's government, the public sector. My view of Headstrong is, in fact, to become the provider of choice, working at scale in partnership with our governments and delivering the nation's best efforts to deal with these wounds of war. So I really wanted to talk to clinicians. I wanted them to know I was real. I exist for them and you. You are the heartbeat of Headstrong. You are the muscle that makes Headstrong perform every day. We are supportive to you. We are aligned around the priority that clinicians come first. My relationship with Dr. Beater, you, Gerard, Dr. Weiss will be foremost. There will never be a decision made in this organization without consulting with the clinical team to determine impact. Truthfully, Dr. Beater, Gerard, and I have already made a few. So we've kind of set the stage around collaboration, equity between the clinical team and the administrative team that's here to support them. And just as a leader of this organization, I just wanted you to know I care, and you're foremost in my minds. I cannot say this as clear as I'd like to, but what you do is what Headstrong does. And we need to keep that sacrosanct. I will always preserve your ability to support the needs of our nation's military-connected populations. I know we've gone through some tough times with COVID. I know we've pivoted to, telehealth. And I know we will continue to kind of build this hybrid model out where one can engage with the nation's best clinicians by virtual presence or physical presence. We'll bring it back. But I just really wanted everyone to know that I'm here for you. I am real. I'm committed to the clinical priority that this organization was founded on. And I just love what you do and want to say thank you.
That's awesome. And Dr. Beater, Dr. Weiss, do you have anything to add or anything more to say about what it's been like to work with Jim so far?
Well, Jim, 2 weeks in, I have to say I'm really excited about working with you, and it's been a pleasure so far. And we really look forward to collaborating with your plans for growth and sustaining what is already a giant organization. So thanks for giving this to the therapists, because I wanted them to see how cool you are too.
Yeah, thanks, Dr. Beater. I love you guys. I appreciate everything you do every day.
Terrific.
Dr. Weiss is trying.
Yes.
She's,
okay, sorry, I got it. I think what's great about Headstrong is that the clinicians are not anonymous, and you've really reinforced that right now. They're not just, though we wanted a private practice model where the veterans were treated, respectfully and not in an institutional setting. They are not working alone, and this idea of yours to communicate with the therapists and the clinicians is just fantastic, to remind them that even we have our conferences regularly. We have lots of ways that we work as a team, even though we're in separate cities. But this introduction of yours really solidifies that idea that we're not working in isolation, that we're all a team.
Thank you, Dr. Weiss. It's really important because, look, especially in the middle of this pandemic, it's really tough to connect to people. And so early on, I just simply wanted to connect and tell you how treasured you are and how I place primacy on what you do every day. And I can't say that clearly enough. So I'm just glad to be part of this wonderful team of professionals. I'll do my best to kind of see this organization achieve its lofty objectives. I work my tail off to make it so, and I'm just delighted to be part of this team. So thank you all this evening.
Thank you.